A lot of Vietnamese, if you look in the coffee shop or on the motorbike, are slouching so much. Studies say that in Southeast Asia, you would have between 50 to 80% of flat foot. Now, all the flat foot are not is not severe. Do you build your back muscle laying down in the bed? No, nobody does that. Okay, so.
Hi, welcome back to Kinis Health Expert Series. This is a series where I, Dr. Thúy Lê, and Kinis team would like to bring all of the healthcare experts to come here and to share with you the scientific knowledge and the very practical can be applied in clinic settings and more. So we can share it all here. And today, with the mission to redefine movement health, with me is Dr. Edouard Sabourdy.
Hi, thank you for inviting me today. So I'm Edouard Sabourdy. I'm a French chiropractor. That's the first thing to know about me. And I've been practicing chiropractic for the last 16 years. I grew up in the French Alps in Chamonix, so the biggest, the first ski resort that happened in history.
Wow.
And both of my parents are chiropractors, therefore that's why I decided to follow their path, because I knew what was the job already, and I really enjoyed their passion, which became mine. I arrived in Vietnam in 2011 when ACC Clinic, the first chiropractic clinic in Vietnam, invited me to work in Saigon. I became the second chiropractor to obtain a license in Vietnam. I've been practicing since then in Vietnam, and I recently opened in Da Nang my own clinic, Da Nang Chiropractic.
Wow, that's really great. So you mentioned that you were being invited. How did they find you?
So exactly the story went by like this. I don't know if you know the movie Yes Man, where you say yes to everything. It's a movie with Jim Carrey. And after that, one of my friends who was supposed to come to the clinic in Vietnam, and he asked me as a joke if I was interested to go. And I said yes, like this, as an impulse. And 1 month after, I arrived in Saigon, and then I fell in love with Vietnam, and I don't want to leave it anytime.
That's great. Yeah. So you were started in Saigon, but now you are in Da Nang, isn't it?
The timeline is that I worked from 2011 to 2017 in Saigon with ACC Clinic. In 2017, I went for a big bicycle trip from Saigon to France, which took 10 months. And after that, I helped to open a clinic in Portugal for my mom, which was relocated from France to Portugal. And in 2019, when ACC opened another clinic in Da Nang, then I came back to Da Nang. Then the company ACC was sold 2 years ago. Then that's when I opened my own clinic.
Wow, that was quite a bit of a journey, isn't it? Wow, can you share a little bit more about your bicycle trip? That sounds very impressive, actually. This is the first time I ever heard about anyone could do that. Yeah.
So I was not the first one to do it, of course. It was a long dream that I had when I was a student, when I wanted to do a long trip in bicycle.
Wow.
When the time was right, I decided to do it. In Saigon, I made a bicycle in steel and bamboo.
Wow.
And then I went through all the countries, so Vietnam, China, Mongolia, Russia, Poland, Germany, and so on.
Sounds amazing, actually. So you mentioned that you practice in Portugal and in Vietnam. Do you practice anywhere else? And if you do, can you share with us about what is the difference practicing chiropractic each countries? Yeah.
Each country has the difference, but I think you can mostly divide between Europe and Asia. So I practice also in the north of Italy in multidisciplinary clinics. That was just after my graduation. The main difference I would say between Europe and Asia is that in Asia people are more holistic, naturally holistic. In Europe, people come to the chiropractor and they have 1 or 2 injuries, and then we will address these injuries. In Vietnam, they want the full body to be understood and to go to the root of the problem. Of course, in Europe, some people do that too, but in Asia and in Vietnam in particular, it's more. I learned it's already a focus of chiropractic to look at the root of the cause, but in Vietnam it was even more interested to do that. That's the first difference. The second difference that I found is because chiropractic was not so famous in Vietnam, people didn't come so much for prevention, which we had to do with the former clinic of my employer, and now we have to do a lot of information to people to tell them that preventing the problem before it happens can really save them a lot of time and money and pain.
Wow.
Okay, so in Vietnam, I had a lot of really severe cases. They didn't know chiropractic, so when they came to us, they tried everything else before. A lot of the patients, they tried to avoid surgery, and some people already went through one or more surgeries, and they are desperate. They have been in pain for 10 or 15 years. They try us, and then we are looking at what's going on, and then we help them to reconstruct their body and health.
Wow. Do you think like the working experience in Europe and in Vietnam for yourself, those quite different or similar?
So for me, I found it at first a little bit difficult, as I told you, because the cases were more severe. And compared to what we do in Europe, we had to do more intensive treatments. But the luck in Vietnam that we were also surrounded with other specialists and the family of the patients, and all this environment made it possible to do things that would be considered like miracle in Europe, like avoiding surgeries.
Wow.
In Europe, they would like jump for the surgery so easily, but here we were able to help so many people to avoid surgery.
Wow. And you also mentioned that chiropractic is not so popular in Vietnam 15 years ago. Then what is it now? Is chiropractic now is more popular in Vietnam?
Yes, it changed a lot. At first, nobody knew what was a chiropractor, so we had to explain all the time. But in the past, chiropractic had become really popular on social media. A lot of what the chiropractic is doing is not cracking, is about doing a proper diagnosis and analysis of the body, the posture, the movement, how it works. Just cracking a bone, everybody can do it. You can do it in the barber shop in Vietnam. In the beginning, we were not famous at all. And recently, in the past few years, because the term and the name chiropractic is not protected in Vietnam, a lot of people are pretending to be chiropractors. And sometime after having done like a small weekend seminars on how to adjust or to crack a joint. We study for a long time in France, okay? It's 6 years before specializing, if you want, in different options. And a lot of these 6 years is actually to teach you when not to crack.
Wow.
And a lot of the patients that have been so grateful for me, I didn't even touch them because I was able to recognize a brain tumor. I was able to recognize a Kodai-Kina syndrome, to refer them in time so they would not have life-changing consequence to their disease.
I have goosebumps listening to you.
Might be sometimes that he does a wrong manipulation because his training is not enough. But a lot of time, the problem with the so-called alternative medicine is to delay the proper treatment of a patient. So to each specialty, what they can do and what they can't do.
So what do you think is the difference between chiropractic and physiotherapy?
A physiotherapist is someone that also works on the body. Nowadays, and more, physiotherapy will start to look like chiropractic. Why? Because what the chiropractors were doing is slowly integrated into physiotherapy. So there are good physiotherapists that are really good at managing musculoskeletal issues and analyzing body movements and posture, and they even start to do spinal and joint manipulation. But for many years, that was prerogative of chiropractic. So even though the difference start to become less and less, right now we are still leading in that domain.
Wow.
And in terms of publication about spinal manipulation, chiropractors are still leading the studies.
Wow, that's actually very eye-opening for me to hear. Coming back to the healthcare of Vietnamese people, what is the most different things when it comes to movement health that you notice in Vietnamese patients when they come to you compared to other nationalities?
We are all humans, right? So European guy, an Asian, Vietnamese guy, or woman, or kids, we all walk on 2 feet, we all sit too much, we all look at our phones too much. There is some variation, and I'm talking more about statistical variation. In general, Vietnamese so far are not as big as European had become already, even though the trend is changing, and that will be a problem in the future. But most of Vietnamese are quite skinny and lightweight, which was a blessing for me as a chiropractor because it's easier to treat them. When you have a 150 kilo patient,
wow,
and we see a lot of them in America or Europe, it's quite difficult to move the joints properly, okay? And it's also a comorbidity factor for a lot of musculoskeletal issues. Vietnamese are more flexible, and therefore in Vietnam the big surprise was to see how many people had issues related to flat feet.
Oh.
Because flat foot is an issue. We will talk about that maybe later, I think so. But flat foot is an issue that is partly genetic and partly developmental. Okay. So there is this. Good posture also. A lot of Vietnamese, if you look in the coffee shop or on the motorbike, are slouching so much. And the kids nowadays. So normally we have 3 curves in the spine, and in Vietnam I saw some teenager where they have only 1 curve anymore. Like it's only like a long kyphosis from the low back to the neck, like a C shape, like a shrimp. And this is also, when we see that on a teenager, it's pretty scary because we probably didn't see that in the past. Now they don't do enough sports, they study all the time, or they look at the phone. It's something that we have to be aware, because when this generation gonna reach even like 30, 35, 40 years old, they're gonna have disease that belong to the 70, 80 years old. And that would be a cost to them and to the society. So yeah, if you have your teenager at home, make sure that they have a proper posture, and also make sure that they are working out. We need to use our body. We don't sit all the time.
Actually, flat feet is definitely something that's been talked about a lot in the healthcare space for Vietnamese kids and people in general. So can flat feet be actually improved or fixed?
Yes, so flat feet in Southeast Asia is more prevalent than in other parts of the world, and especially if you compare to Europe. Now, what we know is that if you compare Vietnamese population that immigrated to America, so maybe second generation that grew up in America, to Vietnamese here, the ones that grew up in America will have better arches in general. That is the first point. The second point, a few years ago, I went to an orphanage and to check the spine and feet of all the kids. And these kids, they were playing on the dirt all the time, and they were always barefoot. And guess what? We didn't find any flat foot.
No way, really?
No, we also do a lot of screening in the schools in Da Nang, in Saigon. And when we do the screening, the amount of flat foot and severe flat foot is quite a lot. So it could be about 50% of
50%? Oh my gosh.
Yes. Some studies say that in Southeast Asia, you would have between 50 to 80% of flat foot. Now, all the flat foot is not severe. What is the most important, and I saw that while practicing for 15 years treating feet, the arch is not the most important. It is something that is important, because having a good arch is what gives you the bounce, saving the energy when you are walking. It's like a spring. But the most mechanical issues will arise not from the arch, but from the pronation. That is when your feet are rolling inside. the navicular touching the floor. Flat foot degree 3 comes with pronation. Okay, and all the other degree come from a certain amount of pronation. When you have pronation, what happens is that your leg is turning inside, your knees are looking at each other. You're going to have these women that have knee pain just under the kneecap from patellar mark tracking, so gonna create some patellar syndrome. But also the pelvis will move in anterior pelvic tilt, which will create a lower cross syndrome, a lot of low back pain, and from this it goes up to the neck. So we are really looking at the pronation. It's one of my priority. Some population have flat foot, functional flat foot. Okay, that means that when you put them on a scanner, okay, the arch is like you don't see much arch. Okay, but if you look at the ankles and the ankles are straight, really unlikely to develop musculoskeletal issues from them.
Wow. Can flat feet actually be treated by, training and exercises? Can that fix flat feet?
Totally. And that's another thing that I discovered when working in Vietnam. The clinic I was working for was heavily oriented toward treating the flat feet. As I told you before, flat foot, partly genetic, partly developmental. We had to understand why the kids are not developing a proper arch. And the reason why they are not developing proper arch is because their foot is not getting enough stimulation. The stimulation from walking on natural playground, from jumping, from running, the muscle in the feet, but the muscle in the leg and the muscle of the hips are not developing enough to allow for a proper alignment of the joint. So the point is that if you treat the kids with proper support and with exercises early enough, and we saw that the sweet spot is to start between 3 to 5 years old. If you do that in time and in a certain way that you stimulate the muscle, then yes, you get really good results.
Wow. So which age, what is the best age to screen for flat feet? Is that 3 to 5 like you just mentioned?
The best age to start is between 3 to 5 years old. The feet is still, of course, really soft. In the clinics right now, we are creating insole that is overcorrecting. What is the principle? Is that you create something that is uncomfortable under the arch, like a pebble. And when the kid trying to avoid this pressure is creating muscle. So that's one of the things. But you also need to enforce the thing that they have to exercise on natural playground. And when they exercise on natural playground, could be sand, could be pebbles, could be grass, hiking. They have to do it barefoot or with barefoot kind of shoes.
That's great. What can you further explain to us about the relationship between flat feet and problems like scoliosis or poor posture or not good alignment of the spine?
So flat foot, as I told you, with the pronation, when you have pronation, the legs are turning inside, okay, the knees are looking toward each other, and then naturally, because of the shape of the hips, then naturally the pelvis goes forward. So that creates a problem that we call lower cross syndrome, with also weakness in the gluteal muscle and the core muscles, okay, and tension that can go into the hip flexors and into the low back. Regarding whether the flat feet can create scoliosis, so most of the scoliosis are said to be idiopathic. Idiopathic means the doctor is an idiot. It's because we don't know, idiots, right? It's because we don't know, or we don't know yet, why the scoliosis happens. Some theories is that a lot of them will happen from a neural tension, and that's what we are treating in chiropractic. Sometimes this scoliosis can happen also from in imbalance in the way the feet are pronating. So a lot of time you will not have a symmetrical feet pronation. You can have one foot that is more pronating than the other. And as I told you, one foot like this another one a little bit flatter and pronating, then not only you will have the pelvis turning anteriorly on the side of the pronation, but you will also have a pelvis drop. And if the pelvis is dropping on one side, then the spine is compensating with a curve. If it's treated early, it's not a problem. But if you wait for too long, this compensation of the spine goes with a rotation of the vertebrae. And when that happens, the scoliosis is more difficult to treat. So for scoliosis, you need to be really attentive between 8 to 16 years old. That's when the scoliosis can really aggravate really fast. So we also screen for scoliosis, so spine and feet when we go to schools. That's really important.
I think this is a question that a lot of people would like to ask, which is, can you completely fix or treat flat feet? Can it like completely be better?
As I told you before, there are different degrees of flat feet.
Okay.
What we want to fix is to fix the flat foot that can create problem. So if we see a kid with a pathological flat foot, like for example, this one is pretty bad, and a degree 3 flat foot, and we can come back to a degree 1 or degree 2 that is not severe also, then it's not a problem anymore. Yes, you can completely fix in the sense that you can completely help flat foot, but you don't. A lot of the kids will come back to a non-pathological flat feet. That's the most important.
So we have been talking about kids quite a bit.
Yeah.
But another question is that, do you also see flat feet in like older people, adults, fully grown adults? Do they also have flat feet or only happen in kids?
No. Of course, if a lot of the kids are not treated, then they will become adults with flat feet. So the adults, most of the kids that come for flat feet, they don't have symptom of pain. When you have 3 or 5 years old, you don't have. So we are treating preventively. Most of the adults who come for flat feet, they have symptoms, which could be low back pain, a lot of time knee pain or hip pain, ankle pain, or plantar fasciitis. And in that case, the treatment is quite different. If you provide and decide to provide an insole orthotic, custom-made insole, then the role of the insole is not to stimulate and make a normal foot, but it's to support and create comfort and alignment. And during that time, the patient needs to exercise, strengthen their feet, to correct the primary issue. But with adults, and the older you get, the less the foot is flexible. So some patients will be able to improve their flat foot, some are not. If they are not able to improve by themselves, they will need to have supportive insoles.
So there's actually a very important notion that I want to refer back to, which is why the kids that like play barefoot on the ground, like on the dirt, they don't have any, flat feet problems. Could you please like explain that? Because it's really boggling to me to understand it.
Yes, so there is 2 things when I said that sentence that the kid didn't have flat feet when they play barefoot on the ground, right? They play on the dirt, and it's not only playing, like that's their life because they don't have shoes. The 2 points that you have to understand, 1, they were on natural playground, and 2, they were barefoot. The foot needs stimulation. How can you build a muscle without stimulation? Do you build your back muscle laying down in the bed? No, nobody does that. Okay, so here is your bed. It's like a bed for your feet. It's so comfortable, right? But then your foot and the muscles that are around us, here we're talking about tibialis anterior, tibialis posterior, we're talking about the hips. They get much less stimulation. If they don't get stimulation, they don't grow. If they don't grow, you have flat foot. I do recommend 2 things. Be active, on natural playground, be barefoot. But being barefoot, you cannot be barefoot all the time. What if there is a nail? What if there is a little stone? It's a little bit, until your skin is really strong, it's a little bit hard. And nowadays, I don't think it's practical. So there is this kind of shoes, okay, the barefoot shoes. I think this one we call Lucy.
Yeah,
right?
so this is a barefoot shoes from Kinis, and we call it Nomad.
Nomad,
Yes.
okay. So there is a few things that really it's minimalist, okay? So it's not a few things that you add to this one, it's a few things that you remove. You remove the drop of the heel, so your ankle is at all it's supposed to be. You are not supposed to have your heel higher than your toes, right? Otherwise, you're going to have like a short Achilles tendon, short calves, and when they are short, they're more likely to be damaged when you really solicitate them. You have a lot of space for the toes with a fabric that is flexible. Okay, instead of putting all your toes together, okay, now you can use, because this is so flexible, you can use your toes in a natural manner, okay? Then you are going to stimulate all these muscles.
Wow.
So this is what I would like highly recommend if you want to build a proper arch, okay? And I highly recommend to do it at first progressively, of course. You are not going to do your first half marathon with this on the first month, but little by little, you rebuild your feet to have a natural foot, and it's not asking too much to just be natural, right? So that's...
Wow, that's very eye-opening. Thank you. Wow, so we learned so much from Dr. Ed today. Like, he talked about something that is super practical. It's not something like rocket science, like nobody can understand, but it's actually like something that is so practical and we can see in our daily life. Before conclude everything, could you please have a short message that you could share to everyone to take home, basically, please?
Okay, yes.
Yeah.
It would be short. So when I opened the clinic in Da Nang, I wanted to emphasize that, of course, I was treating the back issue. This is the main specialty of a chiropractor. But the slogan of my clinic is back in motion. I want to put people back in motion. I want to have them move again, move naturally if possible. I think that's the message that we have in common with Kinis. We want natural movement, and I want people to become healthier through movement.
Wow.
Thank you for inviting me.
Thank you so much, Dr. Ed. If any of you have any questions or concern, and most important, if you think that you or anyone you know have fat feet problems or any musculoskeletal problems, and you would like to see Dr. Ed, the expert sitting next to me right here, you can come to Da Nang Chiropractic Clinic. Thank you again, and looking forward to see you in the next podcast of Kinis Health Expert. Bye bye.